Diabetes can cause erectile dysfunctions by a couple of mechanisms. Diabetes is basically when your blood sugars are too high, and consistently elevated blood sugars cause damage all over the body, namely to blood vessels is what we're concerned about in this case. So the same way that it damages the blood vessels in your heart and increase your risk for a heart attack, diabetes damages the blood vessels, the tiny blood vessels that go into the penis that need to dilate and fill up with blood for an erection to occur. So if you have a disease that's damaging your blood vessels in your heart, it's going to damage the blood vessels in your penis and cause erectile dysfunction. The other way that diabetes causes erectile dysfunction is by elevated blood sugar levels causing damage to the nerves. Now, the way erections work, in addition to the blood flow, you need to have the nerves signal to the penis that it's time to have an erection. And if those nerves are damaged by diabetes, that signal doesn't go through and the erection won't happen. So not all men with diabetes have erectile dysfunction, but they are certainly at a much higher risk, and it's very well studied that fixing diabetes with diet, exercise, and medication if necessary will cure erectile dysfunction, or at least make it significantly better in a lot of men. And men with diabetes can take the usual medications for erectile dysfunction. There's really no specific risk associated with the diabetes and taking those medications, but they should really focus on treating the diabetes first, because they might not need the medication, and if they do, the medication is much more likely to work. Similarly, with the inflatable penile prosthesis or the penile implant, the diabetes management might improve the erectile dysfunction enough that the patient will be able to achieve adequate erections with just medications or injections and not ultimately require a surgery. And if it doesn't, then controlling the diabetes makes the surgery much more safe. Diabetes increases the risk of infections throughout the body, and infection is the biggest issue that we worry about with a penile prosthesis. In a patient who doesn't have diabetes, that risk is really only about 1% in their whole lifetime. But the worse the diabetes is, the more that risk goes up. And if an infection does get into the prosthesis, there's no antibiotics that's going to make it go away. They sort of have their safe ground in the prosthesis, so that means we have to take the whole prosthesis out. So we're very skeptical about putting in a prosthesis in a patient with uncontrolled diabetes, and we always emphasize controlling the diabetes as much as possible before moving on to penile prosthesis placement. We will put in a prosthesis in somebody with diabetes as long as it's as controlled as possible and they understand that they are at an increased risk of infection and other complications.